And hello, it's time for Sunday House Call. I'm Eric Shaw.
And I'm Marthel Neville. Welcome to everyone. And joining us is Dr. David Samadi, Chairman and Professor of Urology at Lenox Hill Hospital and Chief of Robotic Surgery.
And Dr. Mark Siegel, Professor of Medicine at NYU's Langone Medical Center. He's also the author of The Inner Pulse, Unlocking the Secret Code of Sickness and Health, which you can still get out there at Barnes & Noble and Amazon if you want to dial it up.
Yeah,
thank you.
Right?
Check it out.
Absolutely.
Good to see you both.
Nice to see you.
So we start here. A new study finds that omega-3 fatty acids from fish oil may help heart attack patients recover by improving heart function and reducing scarring in the heart muscle. Dr. Samadi, you're up on this because I take fish oil, Eric takes fish oil. I eat salmon all the time for that very reason. But is there a downside to taking too much fish oil, and what is it? I don't start there.
We've spoken about omega-3 fatty acid for forever, and everyone knows that on microscopic level, what it does, it's for healthy cell membrane. Our bodies consist of billions of cell membranes. They need to communicate, and that's what omega-3 fatty acid does to keep your cells healthy. On macroscopic level, we know that it can reduce inflammation, arthritis. It's great for your heart. It can increase your good cholesterol, HDL. That's why, Arthel, you're taking it. It can reduce your triglyceride, good for brain, great for Alzheimer, and study after study talks about the benefit of omega-3 fatty acid. Today, what we're talking about is for people that already have had a heart attack. This is about 360 patients who have had heart attacks. They put them on high dose of omega-3 fatty acid. This is not the vitamins that you're taking at home, so listen up. High dose of omega-3 acid. For 6 months, they followed them. Some took it and some took placebo. And what they found was that if you're on high dose of omega-3 fatty acid, it can increase your cardiac function, your heart function after you've had heart attack by 6%. And it can reduce scarring of your heart by 5.6%.
Well, what's a high dose? I mean, can you get a high dose if you go to the drugstore?
Not yet. But let me just, about 4 grams. You guys and myself, we're taking about 1 gram, which is much lower. And now, you would say, for example, what's the big deal about 6% improvement on your cardiac function? It's a huge deal, and it's the first time we see that something like omega-3 fatty acid can help in remodeling of your heart. We never knew that. It makes a big difference whether you can go up the stairs or like not being fatigued, and pumping that heart and improving your heart function is a big deal. This particular study talks about a very high dose purified omega-3 fatty acid, which is not available yet. It's FDA approved. They used it in this, but we'll see what happens in humans.
What if you start downing a lot of, 4 times the amount when you go to the drugstore? What do you get, like 1,000 caplets, 10,000?
1 gram.
What should you do?
Well, first of all, you're not going to do that, and I'm not going to tell anybody to do that. I want people out there to know what it is. We're talking about omega-3 fatty acids, which the body doesn't make, Eric. You have to take it in from external sources. And you know what? The American diet has 10 times the amount of omega-6 fatty acids. We need both, but we need a lot more omega-3s than we're getting. What is it? It's a polyunsaturated fatty acid. It's found in plants, it's found in nuts, it's found in fish, as Arthel was saying. It's found in fatty fish like salmon, halibut, tuna, mackerel. Really good for you, this stuff. The question now is, though, do you need it in supplements as well? Are we getting enough in the fish we eat? Because we say to pregnant women, watch out, have 2 servings of fish a week, according to the American Heart Association, but not more because of all the mercury you get with fish. So can we take them as supplements? All 3 of you take supplements a day. I take them as well. The goal is to decrease inflammation in the body, because studies show that, and this study also showed it decreased the amount of inflammation. It decreases your tendency to form clots. It improves blood flow to your coronary arteries. It decreases your risk of having an arrhythmia, where your heart beats irregularly. And it helps you think more clearly. Great stuff. That's before this study came out. Now, what does this study add? This study is a prospective trial like David and I like, where they literally followed 360 people over 6 months who had had a heart attack. And they found the actual heart muscle improved after they gave a high dose of this supplement.
So even if you haven't had a heart attack, you're saying we all should take this?
Well, but I wouldn't take 4 grams. But my take-home message here is, if you haven't had a heart attack, consider taking this if you don't have a risk of bleeding, because that's the big downside. If you have a risk of bleeding, you should check with your doctor. I wouldn't tell anybody to take 4 grams out there, because this was specifically for the group that had already had heart attacks.
How much should you take when you go to the drugstore?
It's very interesting,
how much should you take?
Because American Heart Association talks about taking about 3 grams if you're really at high risk
Right,
of,
right.
if you have high triglyceride, you have a family history of cardiac disease, if you have coronary artery disease, you should talk to your cardiologist, and they go up to 3 grams. The truth is that a lot of times, if you take that much, there could be side effects, and we've seen
Like
some
what?
studies, like, for example, increase the risk of prostate cancer we've seen in men. That's why
Absolutely.
we don't want them to take too much dose, because there could be other side effects. You may have bleeding. I mean, you know, there are people that are on Coumadin, they're on aspirin, they're on blood thinning medications, they may have bleeding. And but also, if you're ever planning to go for any kind of surgery, always stop your vitamins, especially your omega-3 fatty acid and fish oil, 2 weeks before, because you don't want to have any kind of complications.
Great
Basically,
point.
bottom
That's
line,
a great point.
We got to go.
Let's be
Basically,
able to
bottom
focus.
line, it's a good thing.
That's a good thing, but we're currently recommending 1 gram. David just said in certain cases, higher risk, more than 1 gram.
Also,
Talk to your doctor.
you can
though,
also
too.
take 2 to 3 servings of fish, which is almost as good. So supplements
quite
are
as
not
much.
always the answer, but talk to your doctor and see,
Okay.
you know, individual basis.
Great.
I like
Right.
it.
Do gummy fish count?
Yes.
No.
They don't have gummy fish oil yet. No,
Yeah, yeah.
Swedish fish is not the same, Eric.
I know.
By the way,
That's
Lavazza
great
is what they
candy.
studied.
wants
Lavazza
to
is
go for an
Lavazza
easy way out.
is the product of fish oil that they studied.
Lavazza is the
Lavazza.
That's a
Okay.
prescription
You go buy it,
type of fish oil.
Okay.
Right.
You can go
That's-
get
that-
fish oil.
that was what was
Get it at the
studied.
drugstore.
All right, get it in the drugstore and
Yeah.
talk to your doctor about
Talk
it.
to your doctor.